Welcome to our Facebook Live session, which is a Q&A on COVID. My name's Drew Mellor and I'm the leader of BCP Council. This is our first Facebook Live session of the new year, so can I wish anyone watching this or catching up with us later a very happy new year, and thank you for joining us. You may well notice this is quite a different setup to how we've been doing these recently. We usually meet in one of our civic offices, and there are two members of Cabinet to answer questions. What we've done today is I'm doing it from home because in terms of the new regulations we thought it was inappropriate to put two people together. So just got me today. What I'll do first, if I may, is a very brief update in terms of where we are with COVID. We've obviously we're now in the third national lockdown, and it's worth making the differentiation. This isn't just a step up in tiers. This is a material third national lockdown. The reason for that is that the numbers, our case rates and infected rates are going up quite severely, not just here and across the country. Our rate in BCP is 548 people per 100,000, which is more than twice as much as it was at its recent peak before Christmas. And those numbers have gone up really significantly. One of the other numbers that's important to us here is we've currently got 272 people across Dorset hospitals, including 82 on ventilation. So our NHS is under genuine pressure at the moment. And why are we here? I think there's an element that it's very much down to the new strain, which we believe is in BCP, and that's important because that strain moves forward much quicker. You're not just hearing that from me. That's been widely reported. It's 50 to 70% more transmissible, and we've never seen rates go up like we have done before. So we're repeating the message about hands, face, and space. But we've got to do more than that. It's transmitting often. Okay, fine. So I'll look for some questions to come up, which would be great. While I'm waiting for those to come, I will give a little bit of an introduction in terms of what the advice is at the moment. So effectively, what a national lockdown means is you must not leave or be outside of your home except where necessary. That's the national guidance. The reasons we may leave home is to shop for basic necessities for you or a vulnerable person, to go to work or provide voluntary charitable services if you can't do so from home, exercise with your household or one other person outside, and that should be limited to once per day. You are able to meet a support bubble or a childcare bubble, and there's quite stringent what those can be, and to seek medical assistance and to attend educational childcare, but for those eligible. And we know that we have all of our secondary schools and primary schools closed, other than to eligible people who are vulnerable or key worker children. The last thing I'll just raise is the fact, if you're clinically extremely vulnerable, you should only go out for medical appointments or exercise if it's essential, and you should not attend work, school, college or university. Okay, fine. So hopefully that's a useful update. I will now go to some of the questions. Susan Lennon's asked, are we in a full lockdown now? And are we going to accommodate the homeless who want to be housed? Susan, yes. I've just reiterated that we are in a full lockdown, and effectively nothing's changed in terms of our position with homeless since March. So every homeless person has an offer of accommodation. So any homeless person who wants it, who wants to be brought indoors, will be. Additionally to that, we've also got something called the Severe Weather Emergency Protocols, which has been enacted now, and it will be enacted for at least the next 4 days because of cold weather. And that's where we work with partner organisations to try and encourage further homeless people to come in and be housed. One of the really important things is that what we've been doing since March, and some great work's been going on, is when homeless people are in, we can really interact with them and try and support them. So thanks for your question, Susan. Okay, yeah, so Mike has asked a question in terms of the high street suffering. It's about supplying post-COVID support to new businesses looking to open on the high street. Yeah, Mike, that's a really strong question. We've got our budget coming up, our council budget coming up, and it will go public 2 weeks on Friday. And we're looking to bring forward some packages to support high street and to support economy in that. We'll see that the Cllr development in Poole There are 10 stores, 10 shops that have been put up to bring forward new businesses and independent businesses. And we're going to look to do something similar across BCP as well, see where we can actively try and encourage that startup business, that entrepreneur. When you're coming out of a recession that we're in, it's entrepreneurs and it's independent businesses that are going to help that. Matt, I just hands face space. I thought it was at home. It's both. When we are out, when you're shopping, if you need to be, if you can't get shopping delivered, the point to reiterate is those messages are never more important. Hands face when we are out, but what is really important in that is that's not actually enough. This is transmitting much quicker than it has done before. So although that message is valid and needs to be reinforced, it's not. We can't rely on it as much as we did. Okay, let's look for some extra questions. So Nick Finnemore's asked an interesting question. Government guidance is talking for schools to be open for children of at least one parent of a critical worker. And this is really important, Nick, and it's something we've been discussing this morning. We've had guidance from government, clear guidance from government, that it's only one parent needs to be a critical worker. And then that person is entitled to a place in school. We appreciate there was some confusion yesterday in terms of some schools, and we're working through that now. Schools have been asked to do an incredible job in no time, and they found out about this situation at the same time as we did. So what they've been able to do has been phenomenal. And as we work through the system and update the guidance with that key worker piece, it's been clearly laid down to us that it is for one parent of a critical worker. Okay, yes, fine. So interesting question, Lorraine Holland, and I think this is really important as well. Lorraine's a retired nurse and she's offered her services with the rollout of vaccinations. There's two things in this. I think there's been quite a clear frustration through retired medical professionals and other practitioners who can help, where they haven't either been able to immediately assist in the vaccinations, or they've been put off by immense paperwork. I was on a call with the MHCLG, Ministry of Housing, Communities and Local Government, over the weekend, and we made it really clear to them that we want those guidance relaxed. This is a time of emergency and we need to take help where we can help, we can get it, and we had some assurance on that from the Minister that they will be doing that. So Lorraine, I'm hoping the process will become clearer. That does lead me on to other people who might want to volunteer to support the vaccination rollout programme. You don't need to be a medical professional. It's not just people giving actually injections that can help. I don't know if many people saw it, but there's an excellent article in today's Daily Echo about the amount of people that have come forward to volunteer to help with the programme. I think it was something like 1,200 in 24 hours. So if anybody would like to volunteer to support that programme, you can do it by going to can100.org, so can100.org, and register there. Effectively, the vaccine programme will be 7 days a week, running from 8 in the morning till 8 in the evening, and I believe you need to commit to 30 hours over a 3-month period. It might be 24 hours, but effectively there is a commitment, but it's over a 3-month period, so it could be light touch, and any help we can get. A lot of that's marshalling, so it's telling people where to go when they come in, and getting people comfortable effectively. But this is a huge logistical exercise, and any help is really appreciated. What we're doing with the council is working out where we can take people out of some services and also support that programme. So hopefully, this is something we can all get behind, and ultimately this is going to be the solution of how we get out of this. Okay. Yes, Belinda Price has asked a question about, are we entitled to grants because our shop has to close, please? Yes, Belinda. So any rateable premises is able to, so i.e. you're paying business rates, you would be entitled, you're entitled to a grant. Colleagues of mine will put details of how to apply on the chat bar, I'm sure, and we'll make sure you get that information. Businesses that have already, so any shops have been, rateable premises that have had to close. Even businesses who aren't having rateable premises but have effectively had to close can apply for what's called a different ASG grant, ARSG grant, which we're also putting out. What's key to say there is if you've already applied, you don't need to keep applying because the money will keep coming to you. So hopefully it's a monthly payment, and that's useful. Okay, so thanks very much for that question, Belinda. Okay, let's look at the next question. Right, I don't want to get too much into exactly the hospital piece because that's the NHS. Very good. So got questions about student nurses going on placements during this lockdown. Again, that's an NHS piece as well as a vaccine rollout. So we're not going to comment on that. Kerry Rosen's asked a question about support. Still be supporting a charitable group outside that have been referred to our charity via professionals, mental health, domestic violence, etc. Can I ask how to make this known to the public when we meet? Social distance, masks, etc. I think this is an interesting question for 2 points. A lot of groups we aren't able to meet, whether that's for recreational reasons or supporting reasons. These restrictions do allow for small groups of people in specific circumstances. So mental health, drug and alcohol dependency groups, things like that. To meet in smaller numbers, and I think the number is 15. So just to say, one, that some groups can still meet in community venues in smaller groups. In terms of your point around how can you make this known, I think it's really important that if anybody's attending anything for any reason, we need to take it significantly more seriously around the public protection and wearing masks, etc., and keeping distance. Okay. Yeah, Leslie's asked a question in terms of how efficient is track, trace and isolate working in conjunction with lockdown in a BCP area. Leslie, thanks for the question. Track, trace and isolate is under pressure. It's under significant pressure. It works really well with smaller numbers. With these numbers now that we're getting, and this is, when you're getting to a stage of saying in England, 1 person in 50, has COVID last week, effectively. So it puts significant pressure on that. So although that system is fundamentally important, there's an element that we just need to stay at home. This is where we absolutely need to stay at home. Yeah, great. Thank you very much. Lorraine replying to Catherine Eden, reiterated that the PM has now said that Matt Hancock is dealing with the extra bureaucracy around the people wanting to volunteer for vaccinations. Tony, yeah, good question. Again, talking about how to apply for the business grant, colleagues will put forward on here, it's an elongated website effectively, but colleagues will put on here how you can apply to that. There's two. There's a local restriction support grant, which gives money to people who have had premises that are closed, and then there's the alternative support grant. We've done 2 things on the alternative grant, Tony. The first is to allow money for people who don't have premises and have been forced to close. The second tranche was for specific sectors. So it was nighttime economy, hospitality, aviation. We've got a strong aviation sector that's had a significant impact here. And they're live now, so colleagues will put forward under here where you can access them. Any problems with that, Tony, please find my email address and come to me directly. Yeah, so Graham Tuffin, hello Graham, good to see you. Is it a legal requirement for shops and businesses not to serve when shoppers are not wearing face coverings? Thanks for the question. There are exemptions. There are some exemptions in terms of wearing face, whether some people are able to wear face coverings. I think it's fundamentally, it's hugely important that we all step up to the plate and hear the messages that are coming through. We have got 548 people out of every 100k, testing positive. When Leicester had their initial lockdown, the figure was 40, and they were putting in a localised lockdown because and we are significantly more than 10 times that now. So everything we do, we need to reinforce the fact that if we are going out, and we shouldn't be if it's not part of the reasons, but we need to be wearing face masks and keeping distance. So no, it's not a legal requirement for shops and businesses not to serve, although some shops aren't allowing people entry without masks regardless, and that's their own discretion. Okay. David has asked a question about litter and fly tipping on the Bourne estate. So it's not a COVID-related question, but it's absolutely fine to ask some questions that aren't related to COVID. Here we're focusing on that. David, all I can say is, when we came into administration on the 1st of October, we immediately put forward we called it a pride agenda, so it's about cleaner and safer. And at last night at council, we put a lot more. We signed off a significant investment in exactly that in terms of litter and fly tipping, and we're working to do more on that as of now. I'll take your concern about the Bourne estate particularly, and I'll pass it on to colleagues. But it is our ambition and it's our promise that this, Bournemouth, Christchurch and Poole will feel cleaner and safer, very, very shortly, and we're going to work, really tirelessly to get that. There's lots of amazing things we want to do and be really more ambitious, but you can't do it if you don't get the basics right, and those basics have been cut back too far historically, and we're now going to put significant resource back into them. Okay, let me look for... Yes, Al King's asked a question around food boxes for people shielding again, as before. Yes, so Al, effectively, we've got about 15,000 people. Technically, they're technically called clinically extremely vulnerable now, rather than shielding. And I know guidance is going out from government to that group in the next few days. We're also contacting all of our clinically extremely vulnerable to see what help they need. So help will be stepped up again. Al, yes, in answer to your question. There's been less support is needed now in that group than was in March. I think it's supermarkets have got much better in terms of food delivery, etc. So we were surprised in the last lockdown at how little support was required, but we're there and ready for it, and we're really, if anybody knows anybody that needs support or is isolated or is vulnerable, please let us know, and particularly in relation to people who are clinically extremely vulnerable. Julia Jones, you're asking about the vaccination and military getting involved. These discussions have been had at much senior places than myself and BCP Council, and my personal opinion is that we really need to do anything we can to move this vaccination piece forward. This is going to be the answer. The Prime Minister today said what's different about this lockdown is this is the sprint part, not the marathon. We need to sprint to get the vaccinations done, so we've got to use anything at our disposal to get it. We are supporting the NHS. BCP Council is supporting the NHS, but it's an NHS programme at the moment, so there's only so much we can do. We are making those messages to government, and I know particularly Tobias Elwood, one of our 5 MPs in BCP, is making that message loud and clear. Okay, I look forward for some other questions. So, Sophie's really important point. The businesses that are directly linked to businesses that are directly impacted. So, for instance, the hospitality sector is impacted, so wholesalers will be impacted. We are looking to step up, the discretionary grant schemes to support businesses across the board, and particularly businesses that haven't been supported previously. So if there's anything specifically about that you don't think our current grant schemes are supporting, we genuinely would like to know about it. We don't want anybody to fall through the cracks. So please contact me in the first instance if you once you've looked at our grant schemes, which we feel now address a lot more of those businesses that fell through the cracks historically. Please contact us, because we'd like to know about it. Okay. So John Steering said, I don't fancy answering your question. I apologise, I haven't actually seen it. So if you'd like to answer it again, I'll try and get to it. Thank you. Can't answer every question, but do try and answer as many as we can. Yeah, so Alison said about will shops go back to stopping groups of families in shops, and the guidance is really clear. You know, shopping is only for essential items. It's not for a family trip. Most shops and supermarkets are now being really clear about saying only one person coming in, or at least one adult effectively coming in. And I just make a plea to anybody watching this or listening to this. We've got to support these our supermarkets and our shops. You know, they are essential services. They're doing amazing work for us, and they are, you know, often, you know, not the most well paid. You know, and you know they're not, you know, at the front of the queue in terms of vaccinations. So we have to do everything we can to support them. So the shops will be enforcing that, and we'll be enforcing that more. But we should really try not to make them have to, effectively. Yeah, fine. Eli, yeah, good question about skate parks, etc. I'll look into that. I'm not entirely sure of the answer because I've been told that we have to close skate parks. If we don't actually have to, I will take that up personally. I think you're implying that government guidance is we don't have to. We can turn that around really quickly if it is the case. At the moment, skate parks are closed. Most outdoor activities are a lot of outdoor activities are open. I know some of the issues is around surfaces. So for instance, outdoor gym equipment is closed, and that's because different people using it and touching it, causes an issue. That said, playgrounds effectively are open, so you can take children there. So there is some work to be done in terms of understanding that. So just to be clear, my understanding, in terms of our local understanding, is that skate parks need to be closed. If they don't, I'll check the government guidance myself. We will turn around a message out on that basis. So thanks for the question and keep them coming in. Okay, right, scanning through some of these. Matt, really interesting question. First question we've had about support bubbles, and there's some really clear definitions in terms of what a support bubble can be. So if you don't mind, I'll just touch on that because I think there's been a little bit of I don't use the word flippancy, but effectively in terms of what a support bubble is. So you can form a support bubble with another household of any size if you live by yourself, you are the only adult in your house who does not need continuous care as a result of a disability, your household includes a child who is under the age of 1 or was under that age on the 2nd of December 2020, your household includes a child with a disability who requires continuous care and is under the age of 5, and if you are 16 or 17, living with others of the same age without any adults. So they are quite restrictive in terms of who can form a support bubble. Matt, thank you. You say your support bubble is your daughter's household, which is great. Can she still stay here at weekends? Yes. So support bubbles are allowed to stay overnight at each other's houses. You can't change your support bubble, but you can have a support bubble under those criteria. And can I also go to my disabled mum's house? Effectively, so it would depend to some extent whether your mum lives alone. If your mum lives alone, then she can form a support bubble, but then you've already got one support bubble, so you wouldn't effectively be able to have a support bubble with your mum. So you'd have to make a choice about which support bubble you wanted to be in. Thank you. And you can't change your support bubbles regularly. And it's also worth noting, you're not, if you've got a childcare bubble and a support bubble, you're not supposed to see your childcare bubble and your support bubble at the same time. So it's only one bubble at a time. David King, you said your businesses works from home, thus not rateable. Can I get a grant? Yes, you can. You couldn't from the government scheme, the local resilience support grant, the first scheme. That's about rateable businesses. When we had a discretionary scheme, we had some money from government to put forward a discretionary scheme. We were clear in the early stages of that even, and it was actually the first tranche of that scheme, even if the businesses didn't have rateable values, they were still able to apply for a grant. So again, colleagues will put forward in this chat bar how to access the grant schemes, but you will be able to apply for our discretionary grant scheme. There are certain restrictions to it, but it's not just a rateable value grant anymore. Okay. Okay, Claire Taylor, interesting. Yeah, so it's not COVID again, but it is something that's we're talking about a lot at the moment. So why did BCP Council plan to cut approximately 600 jobs when so many people in Bournemouth, Christchurch and Poole are out of work and struggling to survive? So Claire, there's a few elements to this question. So we put together 3 councils, Bournemouth, Christchurch and Poole. We're now one of the largest councils in the country. One of the reasons to do that was to effectively save money. We've been through a period of 10 years where we've been making significant cuts to services, and very little of it isn't essential services are we providing anymore. One of the benefits of putting these councils together is we have it's called a transformation plan, what we believe can save £50 million a year every year. It's really important. 1% on council tax is £2 million. So £50 million every year is fundamental. So by making efficiencies and economies of scale in putting this organisation together, becoming a more modern and vibrant council, we will then be able to stop making cuts and start putting more money into frontline services. So turning the time, start investing in what we want to be doing again. And you're going to see some of that in our budget, which becomes live 2 weeks on Friday. So by saving £50 million a year every year, we will be able to stop rising council tax as much as it has been going up over time, and we will be able to invest more in frontline services and other priorities. So there is a reason to it, but we're obviously working through with staff, and it will take a period of time to get to that number of job savings. Okay, loads of questions, and I'm seriously behind in terms of answering them. So I'm about 10 minutes behind, but I'm answering them as I go. So we've only got about 4 or 5 minutes left. We will try and answer questions we can't get to in this half an hour period by typing there. But anybody is welcome to contact me at my council address. Okay, fine. So. Yeah, fine. Hazel, we've talked about supermarkets. I'll try and find a different question. Scanning through now. Yeah, I've talked a lot about grants, so I won't come back onto that. Yeah, fine. Let me try and find something that isn't about grants. Yeah. Yeah, Wendy Hill's, just sort of reiterating, working in a supermarket, and she asks 1 person per household, but if you're a single parent, you can't leave children there on your own, so if you can come in with them. But the key is 1 adult or as few people as possible there. Yeah, Belinda, thank you very much for this is a really interesting question actually. So one of the great things about this whole period, has been our volunteer core. The amount of people that have really engaged, from the community because they want to help people. Belinda says she's at home shielding and she's in the clinically extremely vulnerable category. Is there anything I can do to help anyone, effectively? Which is great, isn't it? For sure. Belinda, yes. So we've got a program called Together We Can. There are many ways of volunteering through that, and you'll be able to find, Google Together We Can, but also look for it on our website, and people can register to volunteer. Many ways of helping. A lot of, and there are other schemes where it's loneliness has been, and isolation has been a massive issue, where people are buddying up effectively and calling people on a regular basis, and that's making a real difference. So even people at home can volunteer. First place is Together We Can. So Belinda, thank you very much for your offer. Nick Finnemore, a question about mass vaccine centres, planned at BIC. Just reiterating, so this is a national health case. We've got a number of vaccine centres opening up. This is now being able to come forward at more pace since the Oxford vaccine was live, because you're able to put those vaccines in places, like Little etc. And a number of those are opening up. Really key point to make about the vaccine, it is relevant about where they're opening up, of course. Multiple sites are opening up. Lots happening through GP practices and primary care at the moment. what is important, and the NHS need us to say, is we will be contacted when it is our turn in terms of vaccines. So please don't contact the NHS. They will contact you. I just run through briefly before we finish the priority groups for vaccinations. So the first group is care home residents and their staff. Second is those who are 80 years and over of age and frontline health. The third group is those over 75, and then you've got the over 70s and the people with health conditions, effectively. So and I think most of us would have been watching the Prime Minister. We want to get through most of that, so the clinically most vulnerable in terms of age and other conditions by the middle of February. And that's why the Prime Minister is calling this a sprint. We're trying to get everything done to get there. We've done more vaccines than anybody else in Europe at the moment. All of Europe put together, because we got there quicker. Now we need to really push forward, and we're actually third in the world in terms of the amount of vaccines we've given out. But we need to keep that pressure on and move forward, because VATs are out here. Fine. Okay. We're actually now at 1:30. We just had a first question in terms of school vouchers and school support. Effectively, we haven't touched on that, so please, I just will answer Caroline Hall's question. Why no school vouchers? School has told me you've told them to issue hampers instead. So since the first scheme, we've worked with schools and partners and actually worked out what actually has been most useful, and we've gone with that advice effectively. It's the important point to make here is that we as a council committed for children of a half-term pre-Christmas, at Christmas, at Easter, would be supported, and we're doing that, and we've done that. So I'll just really thank all of our staff who put that together really quickly. Government have now issued guidance that we will also be supported nationally. So anybody who is on free school meals, and other vulnerable categories, and if people are struggling, please contact us, and we can arrange for support in terms of that. That's effectively that school school voucher and hamper piece. So Caroline, thank you for that question. The scheme's moved on effectively, and we've listened to advice from people. Okay, sorry, we're a couple of minutes over time now, so I'll just reiterate from the top. Our numbers are 548 per 100,000. We before we were, the highest we've got to before was around 250, and literally a couple of weeks ago, 2 or 3 weeks ago, we were down to 60 or 70. So our numbers are going up at a significant pace. This new strain is really fundamentally moving differently and more quickly, and our hospitals are verging full. So I just reiterate the message. This is a national lockdown. This is about staying at home. Please keep questions coming in, and we will answer them in the chat bar or email us. We're going to do this together. We are at the end of the line on this, but there's a long way to go still. We just need to all work together. So thank you ever so much for your time and for your questions. We've had some really good interactions. And apologies I didn't get to answer all of them. We'll be doing the next one of these in 2 weeks. So every Wednesday at 1 p.m. for half an hour. So thanks everybody for your time. Cheers. Bye-bye.